Once again, a very good evening to all of the doctors who've joined in to our webinar today. Well, this is the first of its kind in our series of webinars that we're going to have in the coming weeks from now. Well, clear aligners, also today called invisible braces, well, it's become an entire fashion trend in 2022. So while starting this year in January, let's understand why has there been this large surge in the market for orthodontic treatment as such, especially for clear aligners. Because of this surge of advertisements and so much of market development, we are seeing that a lot of patients are also entering the private practice, asking for clear aligner treatments themselves. Well, clear aligners give the best results, but provided they are at our dental clinic and given under good supervision by the general dentist as well. We are conducting the series of free webinars so that we'd like to get all the dentists, aware to provide clear aligners confidently at their private clinics. And there's been a surge in even the providers of clear aligners under different brand names, different materials, and different processes one follows. Well, ODONTO clear aligners is also one such brand where dentists can provide clear aligners to their patients after having a clear knowledge of the same. When you have so many options of these, we wanted to list down a few important features that you should understand that helps you to choose a clear aligner provider. We've noted down 11 questions that you should ask before buying clear aligners for your patients. So today with me, before I begin, I'm Dr. Zita Antau. I have on our panel Dr. Jenil Parekh, who's our MTS orthodontist. He heads the aligner planning and designing team. Not only that, if I were to say a few words about him, a very down-to-earth orthodontist with extreme brilliant clinical knowledge related to orthodontics as a whole, and not only those principles, but complete knowledge of clear aligners, worked with more than 8 systems of clear aligners in India and abroad as well. He's treated and completed successful at least 5,000 above cases, been in touch with more than 2,000 dentists all over India, and been great with clear aligner practice from day one. He's heading our aligner planning and designing team and is always there just a call away to help you out, even when you are there with your patient at the clinic. He would never, he would always make it a point to pick up your call or guide you if anything is required at that point of time. So we have him on the call with us. Along with that, we have our panelists. That's our entire team of orthodontists also there. And with us today to help you to understand this entire clear aligner journey. So without wasting any time, let's go to what are the questions that you got to ask before buying a clear aligner for your patient. There are there are a few important features that the dentist should consider before choosing his clear aligner system. Why is that important? Is because that one patient who enters his clinic, he's convinced that he requires to straighten those teeth and he does not want to currently put wires or braces in his mouth. And we do not want him to go away without getting that perfect smile corrected. So when you got to choose the aligner, these are the few things that you've got to ask him. The first one being, which is the 3D design system that the aligner company uses?
Yes.
What do you mean by the 3D design system? Well, clear aligner is basically based on 3D treatment plans, which is conducted and designed on a software where Dr. Jenny will help you right now to understand why is it so important to understand the 3D design system used by the aligner company. Yes, Dr. Jenny.
Yes, thank you, Dr. Zita, for the nice introduction. A very good afternoon to all our participants. We are very happy to take this opportunity and help all our participants in the aligner journey. So as Dr. Zita is explaining, let me take this opportunity to explain what is the importance of choosing the right design software. So we are currently associated with 3Shape. We use the Ortho Analyzer software to do the planning for all our cases. So we are using this software for 2 to 3 reasons. One, this software has been the pioneer and it has been offering great support from day one. Secondly, we are able to make a lot of customizations in this software to achieve maximum accuracy and predictability in various clinical scenarios. Third, we have a lot of integration which is easy with this software in terms of making the production and delivery of aligners very accurate. So that is the reason we are associated currently with 3Shape Ortho Analyzer software. The other options are 3D Maestro, which is also a very good software, and end-to-end support. Yes, Dr.
Yes,
Zita.
yes. Thank you, Dr. Jenny. So, as doctors told you, you should ask the provider of the aligner company for details of the design software. You should be aware and visit the software provider if need be, so that you are comfortable with understanding that they are using a design system that would work. The next question that you'd like to ask the aligner company would be that who are the designing orthodontists at the back end, and what are the principles that they are using in order to move the teeth for your patient. Well, the software, the aligners, the provider company are only enablers. But the most important aspect of any kind of treatment plan, anything that you are to give the clear aligner finally to the patient to get his smile corrected, this is only by the skill and experience of the orthodontist who is planning that treatment. So it's just, for example, if you were to get a dish, right? The ingredients and the recipe could be the same, but it would only taste the best if you have the best chef making it. So even here, if you've got the software, you've got the best aligner, you've got the provider, but if you do not have the best skilled person, one of the best orthodontists who have a good experience in planning the treatment, do it, you may not get the best result. So it's very important that you ask your aligner provider for the details of the planning process, the qualifications of the person who's planning the treatment. Uh, as per Odonto, as you can meet them here face to face, we have our head here who's Dr. Jenny. So he can explain to you why is it important to understand the principles behind moving teeth, and it's not just where without an understanding you could use the software.
Yeah, yes, Dr. Zita.
Yes.
The very basis of using aligners to move the teeth is a more sophisticated way of moving the teeth. So aligners are very different as compared to braces. They require a deeper understanding of the biomechanics, and the approach to reaching the teeth in the final goal or in the final position is a very predetermined sequence of tooth movement. So we, with a good software and a deeper understanding of the biomechanics, can easily navigate all the problems associated and reach the final goal in a safe and a stable manner. That is why the understanding of the staging of the teeth movement, the chief complaint of the patient, and also the age of the patient helps us to give a more holistic approach towards the whole problem. Yes, Dr. Z.
Yes. So once again, very important to confirm that the treatment planning is done by a qualified and a trained orthodontist, especially trained for clear aligner. The next, what you'd like to ask is, what are movement thresholds per aligner, or the views of that particular aligner company on certain complex cases? Now, what do you mean by movement thresholds? An aligner can particularly move a tooth only up to a certain amount, and most aligner companies, they would move teeth for a maximum of 0.2 mm per aligner. Now, in these movements, there are rotations, there would be translations, there'll be intrusions, extrusions. To cover all these movement aspects, we would be taking our next 15 or 20-minute webinar next week, regards to how the movements are categorically done by aligners. And we can describe to you how much movement we recommend for each type of these movements. So if you were to see the many aligner companies that are there and you were to give the same patient's plan to one or two companies to plan, there are chances that if one company gives you, say, 30 sets for a particular case, one would finish that case in only 10. The reason being, possibly they are not following the guidelines of movement thresholds. They might be doing more movement per aligner. This results in an unstable final movement of the tooth. So here Dr. Jenny would also like to add in as to how we follow those guidelines wherein a particular movement could be done with each aligner.
So, Dr. Zita and all the participants, whenever we are planning any case or designing a case for our fellow partner doctor, we understand the complexity of the malocclusion, the age of the patient, periodontal health, and the predictability of the tooth movement. So, we have to take all these parameters in mind regarding the type of the tooth movement that is mainly required for achieving maximum efficiency in the tooth movement. Along with that, there are certain hierarchy which makes certain teeth movement more predictable. So according to the hierarchy of the tooth movement and the requirement of the case, we also keep variable velocity. But currently our requirement for every case and our belief is to keep it 0.2 mm, which is safe and biologically stable to move the teeth in a very controlled manner for achieving maximum stability at the end of the correction.
So
Yes,
we,
Dr. Zip.
yes, thank you, Dr. Jennings. So as clear aligners treatment, there's series of aligner trays which incrementally move the teeth. So this movement threshold is extremely important for you to know that whatever you are providing are correct treatment plans, and accordingly you could also estimate a quotation and diagnostic appointments for your patients to that. The next question you'd like to get clear with your provider would be that which kind of cases can actually be done with clear aligners, which are the most suitable ones. For that, if the aligner provider helps you with a training program to understand which cases are to be taken up, this would help you have a very good practice with having happy patients, lesser number of poor prognosis with any kind of orthodontic treatment. If you'd like to have the best prognosis with a happy patient and then him referring more patients, it is best that you know which is the most suitable case for you to take, and in which cases traditional braces and in which cases an hybrid approach could be done. So this is another webinar that we cover, wherein we do a case selection training program for you, which helps you to understand case requirements, and you will, once you consider the limitations that a clear aligner would have. So get that clear with your aligner provider as to which cases can be done. If he tells you yes for all cases, then there's something that you should have, you should look into, because all cases are not aligner cases. Kindly, yes.
Okay, so
Yeah.
I will take this one. So
Yes.
what the hybrid approach essentially means that the part of the process of moving the teeth with aligners is predictable with certain types of teeth movement like tipping, mild intrusion, extrusion. So such categories of teeth movement we plan with the aligner. Now, from that point onwards in the journey for the patient to achieve maximum results, we have to divide the rest of the correction to be planned with braces. So the hybrid approach is to basically take the best from both the worlds, the best from the biomechanically superior aligner movement and best with the when the torquing is required or when long standing extrusions are required, highly placed canines are there, or achieving more stable torque of the tooth root position in the bone. So that part we can always request or guide the partner doctor to finish with braces to achieve a more stable correction. So that's why we have kept this hybrid approach to make sure that the movements which are more easily and safely achieved with aligners are designed in that manner, and the remaining or the rest of the correction can be staged to be achieved with the braces. Yes, thank you.
Yes, yes. So over here, one thing, doctors, that we have to be sure of, that your aligner provider should be very transparent and clear on which cases can be done and cannot be done. Here at Odonto, we would never take up any case that you are not sure about. So you should be in safe hands. It shouldn't be that every case should not be said a yes to. There are some limitations that you should understand. The next question you want to ask would be, which materials are used for the making of the clear aligners? Now, unfortunately, a lot of aligner providers would come to your clinic and would possibly want to market the material that they are using. So just to clear that doubt off, is clear aligners are all done by vacuum forming transparent sheets. They could either be of polyurethane, or it could be of thermoplastic PU, or PETG, or a multi-layered sheet of a combination of two or more materials. So what you have to understand here is that since it is a series of trays and the patient is wearing one tray for approximately 10 to 15 days, the material that is being used is only one of the above. Some are relatively on the harder and they are stain resistant, and some of them are a little more on the flexible side. Formulating this material for an orthodontic appliance, there has to be a balance between elasticity of material and the force that's exerted. So what we do is, you should not get fooled by the fact that someone would say that this material would be superior than this material, because possibly it depends also case to case on what has been planned. You might sometimes have to change the material depending on that particular case or movement that is required. So you should be well aware of the fact that these are the materials that are mostly used. They are not too flimsy, not too rigid. They have to have some clarity, smooth edges, and should try and be stain resistant, because the patient is choosing this clear aligner as an option because he's definitely aesthetically conscious. After which, you should also ask them, what is the process for case submission? Why should you ask them that? Is you should be confident about what is the process for submitting the case, because if you're not sure about that, you'd possibly not take up many cases of aligners. If it is a simple and clear process, which is very easy and at the tip of your fingers, there's a high possibility that you'd like to do that treatment at your clinic. Generally, the process and the management of cases are more or less similar, wherein you send the photographs to check suitability of that case. As I told you, the case selection to be done. You get a quote of an approximate number of aligners or how complex that case would be. You send in the intraoral scan to the aligner company. You'll get a virtual setup or treatment plan for the aligners from the provider. You will then approve that treatment plan or ask for any changes if needed. Once you get your clear aligners by a courier or logistics, then you'll bond your attachments right there and deliver the aligners to the patient. More or less, the process is the same, but you don't want something very tedious, where you have to actually get into a software and fill into details, etc. You want something that would be at the tip of your fingers. So choose a provider that would be convenient for you to work with, and you can submit cases quickly. The best would be if you have relationship managers there at your 24/7 support. That would be the best, because they will guide you through this entire process, making it very easy for you. You can take care of the patient and you leave it to the aligner provider's member to take care of the other details. So understanding the process and choosing something that you would definitely do, because it is a simpler process, would be something that you should look into. Something that you want to commit to your patient, because at the clinic as dentists, we all know that there are a lot of patients who definitely ask you, when would it come? Even if you have done a crown preparation today, the next question the patient would ask you, crown kab milega, right? What is the delivery time now for the aligners? Get a delivery time commitment from your clear aligner provider. Me being in practice for more than 10 years now and having a lot of clear aligner patients, I've been at the back, at the other end, receiving end, to have received from the patient, because aligner providers would not provide the aligners for more than 40 to 60 days. That means my patient has committed to treatment to me, and I and the patient both are waiting for the aligners for at least 2 months to get the aligners from the provider. So this mistake is already, I have burnt my hands there. So with experience, I would tell you, get a delivery time commitment from before engaging first only with that provider. What would otherwise happen is you've committed to the patient a certain timeline. Say patient has to go somewhere and you're not able to deliver it to him. So the trust factor between you and your patient is now lost. And remember, when we lose one patient, you're losing more than 10 patients that he's speaking to. Okay? So then you should ask them for a delivery time commitment. This is important because a patient will ask you about the time. Try and get it as soon as possible, because once a patient is committed to a treatment, sometimes he could change his mind if you take a really long time to deliver. The next question that you would want to know from the aligner company: what are the terms and conditions that they have for refinements and reboots? Firstly, as a dentist who's doing clear aligners, let's understand what's a refinement and a reboot. They are with most of your clear aligner patients, you will come, once you start doing them, you'll realize that most of the times you're very dependent on the patient to wear the aligner. Sometimes he leaves his aligner somewhere and he forgets to wear them. Sometimes he just doesn't wear it for a week. In those cases, there are times that you've got to reboot that case because the next aligner now will not fit. Or digitally, if someone has planned the case and it's not moving biologically as it was planned, there sometimes you require a reboot. Most of the aligner companies charge the doctor again in case you've got to reboot the case. I have a personal example as well. When COVID had struck, a patient had just billed before the COVID had, everyone had gone on a COVID break. So that time, the patient had not received his aligners, his next set of aligners. And after a year or two, he got back to us. And after that, I had to contact the aligner company, the provider. He rebooted the case, but has charged us all over again for the entire case. So these kind of terms and conditions are missed by the doctor. We would not know that what do I have to pay for the reboot, because all those costs you would have to incorporate, because it will be difficult for you to recharge the patient all over again. Again, a trust factor between you and the patient would get affected. Refinements. In most aligner treatments, at the end of treatment, you would require a few refinements. You should find out from your aligner provider, are the refinements, how much do you have to pay per refinement? Some of them may tell you, I will only give you 3 more refinements. Some may tell you, I may give you 5 more refinements, but get it cleared out. So make sure that you must know the policy of your aligner provider company to decide your pricing to the patient. Because in between the treatment, if you are charged, again, it is impossible for you to tell the patient at that time to pay an additional amount. Okay? To save you from that phase, make sure that you have asked about refinements and reboots to your provider. The next would be what is the price or cost of the treatment? This is last but not the least. You need to take a clear quotation of how much you're going to be charged so that you can put a price to the aligners that you're delivering to the patient. Some aligner companies, they base it on the number of clear aligners per case. For example, they could charge you an X amount for each aligner. There you've got to be a bit careful, because if any additional aligners are added later on, you've got to bear the cost of each of them. Some of them do give you a package. They tell you this is all and all a cost depending on the complexity of a case. You will be able to decide your price at your clinic for the clear aligner treatment that you should charge your patient. Please check again for terms and conditions when it comes to pricing and cost, because you will not be able to convince the patient after 6 months or a year of him wearing the aligner to pay any additional amount at that point of time. A very important and close to heart question that you should know is, what is the value system of that particular company that's providing the aligners with regards to clinical and orthodontic protocols? What happens is, whenever you're choosing an aligner company, you should make sure that they're not violating orthodontic principles or protocols in an attempt to definitely do your case. Because you have sent him, the complex cases, and he's wants you to build the aligners. He's taking in your cases and giving you aligners for that case. For example, if an aligner treatment goes on for 4 years, okay, the number of aligners would be at least more than 80 aligners. In those cases, a patient will not be compliant for that long a time. So this kind of value system should be understanding, wherein, like as Dr. Jenny has explained about a hybrid approach, it would be more beneficial for that patient to put braces for a particular time and then move to aligners, so that his treatment and his smile is gained in just the span of 2 odd years or so in a complex case. So such kind of value system of understanding that even your aligner provider, your clear aligner company, also understands your patient completely and follows that ethic while giving a treatment plan, and not giving a plan to just make you bill a clear aligner case. Yes, Dr. Jenny, you'd like to add in?
Uh, so as Dr. Zita has very nicely explained, our approach is also the same. We believe in a holistic approach. We always want to keep the best interest of the patient in the mind. We believe in supporting the doctor right from the case selection point till the aligner delivery planning, keeping in mind what is the safest and most predictable way of moving the teeth, and allowing the doctor also to identify the same. So our also efforts will be to educate more all of you all in that direction, to help you select the right cases and execute them in a safe manner.
Yes, so this is an important thing to understand about that clear aligner company. Again, because we have seen cases wherein a treatment plan would be given where a tooth that you would have never extracted has been removed or so. So then that's where you understand this, those clinical protocols, something you do not want to follow. To give you a brief of these 10 questions that we've covered till now, as to which 3D design system at Odonto Clear Aligner, it's 3-Shape Denmark, as Dr. Jenny has told you. Designing orthodontists, you're meeting them today itself on our webinar, where they have designed more than 30,000 smiles, delivered them happily with so many dentists all over India. The movement thresholds are correctly by orthodontic principles, by the book, not moving to maximum movements. We will be covering movements in the next webinar for you to understand each of these thresholds. Case selection, we are transparent with cases. We never take up cases that cannot be treated. You would be said a no or told to do braces at least for a particular amount of time, which is a hybrid approach. Materials used here are PETG materials. They are stain resistant, high clarity with smooth edges. Training and support, we do weekly ebooks, weekly webinars. You have a 24/7 support from you have a relationship manager with you and aligner experts always there to pick up the call when your patient is there. Delivery time, we give you a virtual setup so that you can convince your patient by showing him a virtual setup. So in 2 days' time, we deliver the aligners within 7 days. Just to mention here that even when our patient was leaving in 2 days, we have also delivered urgent cases like that in a record time. So the delivery time is very quick. Refinements and reboots are not charged because we totally understand that it is a patient compliant treatment. We have to understand that there are chances sometimes a patient may not comply. So we want to complete the treatment as said by the virtual setup. So refinements and reboots that are required, we do not charge our doctor in between the treatment. There are no false commitments given. So that tells you about the entire value system with all the doctors who are planning, an orthodontist in the team planning it. It's a guaranteed good price, the best price you could get, and it doesn't vary and on the number of aligners, because we could just add up aligners and charge you more, which doesn't happen. We give you a cost and tell you the complexity even the time we see the photographs. The last point, which is about the training and support, to give you, we have an aligner provider program. We've already conducted more than around 6 webinars till now, and had around 1,000 plus attendees for these, and successfully they are doing aligners at their clinics. Our next batch is on 27th, 28th, and 29th of January. It's a 3-day comprehensive training, 1 hour per day, where most of these aspects are covered during these 3 days to make you successfully deliver aligners to the patients. It's a perfect way to start your clear aligner practice. And we also teach you how you could increase aligner practice at your clinic by selling the Odonto way. To connect, you can call on these numbers, or even with your relationship managers, go onto our website and take down the numbers 750-604-0404. Connect with us to join our program on 27th, 28th, and 29th of Jan. We are having all those who have attended the webinar today, only for you, we'd be discounting that price. You'd be saving around 1,000 rupees. Along with the webinar, this Odonto provider program, we let you do one case with your patient for free, so that you can utilize the entire program in actually delivering the aligner to the patient. So whatever you learn in the webinar, you will be doing it at your clinic. So we make sure that we also give you aligners for one particular case during this program itself. So if you get the case after a month or so, since you have attended that webinar, the APP, you will be able to deliver the aligners to a patient. Okay, this is our 7th APP batch, which is starting on 27th. We'll be covering all of the aspects of case selection, how to deliver aligners to a patient, how to be confident in increasing the sales of aligners at the clinic. In this 3-day program, we promise a 3-fold growth of aligners at your practice. So if you have never given clear aligners in your clinic today, we are promising that you will be delivering aligners at your clinic in the coming month. And if you're already practicing aligners at your clinic, we are very sure that you would definitely double the number of aligners that you're doing. I hope this was informative and beneficial session to all of you in choosing the correct clear aligner provider. We would be touching on each of these sessions, having a shorter webinar each time so that you can attend even from your busy practice and come into joining us in these sessions. Yes, would you like to ask our orthodontist or me any questions regarding any doubts that you have about clear aligners, which provider to choose, how to give it to the patient? Please feel free to ask. Yes, Dr. Anurag. So we cover how to take proper photographs in our 3-day webinar. It's part of the 2nd day. Dr. Lydia, so how do we stand out from other companies is in each of the 11 points that we did cover. This is it. Whether it is our commitment, the delivery time, the support.
Regarding the delivery, I would want to answer over here. So this is Vikram. I help the team get the delivery in place. So in terms of how we differ from other provider companies, uh, like Dr. Zita said, each of these are a point of differentiator that we believe we have against other aligner companies in the market. So where we believe that the success of your treatment depends on how much we are transparent with you, right? I mean, at the end of it, the dentist is the provider. We are only an enabler. So we need to provide more and more information. So you will not have any other aligner company that provides you all these information. You have direct access to the orthodontist. No other aligner company will give you access to their design team directly. Each of our relationship managers work very closely throughout the treatment plan as well as the treatment period to ensure that you are getting the exact same service that we promise at our webinars at APP, and we take each and every feedback by our dentists very seriously. In terms of materials, we ensure that we share with you which particular resins we use, what is the printing resolutions that we do in our 3D printers. We also tell you that we use PETG sheets, which are of which thickness, so that there is nothing that you don't know. And if a patient asks you a question, you should be able to answer. Training and support, we have an entire module of APP dedicated to each and every aspect of clear aligner treatment as a part of a provider program. And if you actually take a review from people who have attended our aligner program, provider program, you will see that after that, whether you use Odonto or any other aligner in the market, you will find that your efficiency as far as delivering the treatment enhances extremely. And about refinements and reboots also, no other treatment, no other provider provides free refinements and reboots like the way we do. I mean, we actually want to support our dentists as far as that is concerned. Delivery time, we are very confident that as of now in India, we would be the people who are the only aligner company that can deliver consistently within 7 days of approval of a plan. Most other companies take 30 to 45 days to deliver, which also increases your loyalty, the customer patient's loyalty towards you. And as far as price is concerned, we are unarguably the lowest price product provider in the country right now. More importantly, when it comes to the entire treatment. So we don't price it by the aligner. The only way somebody can actually tip us as far as costs are concerned is by giving you a price that is per aligner and then reducing the number of aligners by compromising the number or the movement thresholds by increasing the speed of movement. So I guess these are the preliminary differentiators that we kind of live by. Thank you, doctor.
Yes, yes. Thank you, Dr. Anurag. Also, he's written here that he's very happy he's been using Odonto aligners and he trusts us. Thank you so much, Doctor. Dr. Lydia's question is if there are cases which are deemed rejected by us and the patient is keen on how will we support you? Well, the hybrid approach the doctor had spoken about, Dr. Jenny, is where here you would require an orthodontist to come into your clinic, wherein he would start with the braces or possibly need to end with the braces in certain cases.
So what we usually do in such scenarios is break down the treatment, give you
And
the
give a plan.
guidance. Yeah, we give you the guidance on which part of the treatment is undoubtedly to be treated with braces, help you pass on that message or directly connect with your orthodontist, explain to him what is required to reach the stage where we can continue or start with the aligners. So that is how we help you. So it will
Support
be a
you.
very case by case approach, but we do make sure that we give you a blueprint of how to do justice to that patient.
And one thing that I didn't mention that all of you would also be interested in, that if a particular treatment plan is shared with you, a virtual setup, We could go on a Zoom call like this and explain the entire virtual setup of your patient to you so that you will also be part of the planning. So if you would like to know onto, that would this, could we do a little bit more here, there, or how it's to be done, you could give us a call and we can connect with you per patient also on a Zoom call like this and on a video show you about your particular patient. What cases are completed? A complete no-no for aligners.
So the cases which are not at all required or recommended for to be treated with aligners are the cases with severe skeletal discrepancies, severe deep bites, and severely highly placed canines or impacted teeth. Such cases are on a broader perspective, not to be treated with aligners. I'll repeat it again. So
Yeah.
the cases which are not very desirable to be done with aligners are the cases which have underlying severe skeletal discrepancy, very highly placed canines or locked out teeth, impacted teeth, and teeth which are, or the cases in which there are severe skeletal deep bites. So such cases, we either need to combine it with microimplants or do some pre-aligner orthodontic correction, and then we can guide you to correct it with a further stage with aligners. If it is very severe or borderline surgical, we will definitely guide you on day one itself to not to consider doing aligner therapy. So in the subsequent session, when we do the case selection, we have a lot of photographs and cases to show to everyone to explain visually how to evaluate a case so that it can be predictably corrected with the aligner.
Thank you all for attending. You've been a great audience and great participation. We do want to meet you again for shorter webinar series so that we could add more value and give you more and more information regarding clear aligners so that you can all make a very informed decision, help your patients out, grow your practice, and not miss this bus in 2022 where aligners is a complete trend currently. Okay, thank you, Dr. Jenil, as well.
Yes, thank you, Dr. Zita. Thank you all the
Yes,
participants, and we look forward to meet you on 27, 28, 29.
glad to have you. Bye.
Yeah,
Bye,
take care.
doctor.
Have a good
Yeah.
day.